Hi, I'm Dr. Jim Mellert. I practice general dentistry in Torrance, California. And what we've done today is kind of put together an interview with the topic of dental anxiety. And I have a patient of mine who's just has a fantastic story that I think will be interesting for everyone to hear. I'd like to introduce you to my patient, Gary. Gary, good to see you.
Dr. Mellert?
Gary is preferred to be off camera, and he is going to tell his story of his dental anxiety and also describe the progress that he has made in this last year. So Gary, if it's okay with you, let's go back to about a year ago. You called our office with an excruciating toothache. You expressed to my staff that you were highly anxious. And that's really that's all I knew when you came in. So why don't you briefly tell your story of the very beginning?
Well, as with most people who have dental anxiety, it's not something you go around talking about or discuss with people, but you find an excuse not to go to the dentist office until you have a problem that can't be ignored. And then you come in and they look at you and like, what's wrong with you? 3-year-olds have dental anxiety, not adults. But it's real. It's an irrational fear.
Okay, so what I sensed from you that first visit, as I think back, was tremendous embarrassment. You said that you essentially felt ashamed for just not coming in sooner. You're being honest enough to tell me about your fear. I completely respect, and I want to do everything I can to minimize that fear. As I recall, I told you that I have had an anxiety-related experience that happened on a ski lift where I got stuck on a tram really only for about 20 minutes. But I didn't know it was only going to be 20 minutes. I thought it was going to be longer. And I came just seconds away, I think, from completely losing it, which would have been very embarrassing. I recall sharing that with you. And I think that kind of broke the ice with us a little bit.
It did, because it made you realize that you had not quite the same fear, obviously, but a very similar fear, and it really relaxed that embarrassment part. When you do the actual work, the other nice thing about it is from the minute I walked in, you said, look, you're my boss. So you gave the control of the experience to me. You were very thorough in making sure I was numbed properly. It just took the time to make sure I knew what was happening next. I said, well, I'm going to do this now. It was never a surprise. The first couple of visits were pretty tough, and it gets better every time. I'm not going to say it goes away, but it found a way for me to come in and feel comfortable and not just abject fear.
So the whole thing, at least my theory, is that the more control I give you, the less anxiety that you have. So I even made the statement to you, and I say this to patients all the time, aside from the fact that you're my boss, that you can leave at any time. Give me a couple minutes to make a temporary or do something, but there's nothing that we're in the middle of that we can't just stop and you can leave if you had to. And I think with a lot of patients, that's reduced their fear.
That was very helpful, knowing that it was always in my best interest to stay and get everything done. But knowing that if I had to walk out of the room for 10 minutes or 15 minutes, it was no big deal. Yeah. You were going to go out of your way to make sure it happened. You also have a variety of medications. There's, I guess it's nitrous oxide.
Well, nitrous oxide, and we have different pills that can reduce anxiety and in the way of tranquilizers. But I really wanted...
That wasn't for me, but it was nice knowing that I could do that.
Yeah. No, it's a huge deal to you and everyone else that has any form of dental anxiety. And you used the word debilitating before the camera started, and it can be debilitating. So I applaud you for all the steps you have taken. We still have more treatment ahead of us in the future. Final word, maybe if someone on the East Coast is watching this and they're going to the dentist and their dentist really maybe is kind of putting them down or shaming them or kind of giving them a bad time because they're not flossing or they're not coming in regularly, what could that patient tell the dentist about their own anxiety that might help?
Well, maybe to have them watch this video to try to explain things a little bit, and try to go to the dentist first before you have a crisis.
Yeah.
Try to develop a relationship, explain to them that, say, I need a cleaning to come in.
You know, I think to dentists out there, my approach has been incredibly successful with patients with really severe anxiety.
So we just have to be conscious of it, and the practitioner has to understand what's going on and have a little patience. And I think between if the patient's willing to work and the doctor's willing to work, it's something that can be overcome.
Thank you so much for watching our video. I just want to mention that, you know, Gary's message is a message that there's hope for those patients with dental phobia, dental anxiety. If you're a procrastinator, you know you have a dental issue, it's been a long time since you've been to a dentist, I think it's a great idea to schedule a cleaning visit, or even schedule a visit, just meet the dentist. If you can't bring yourself to even walk into the dental treatment room, ask if the dentist will just talk with you in the waiting room. And I really hope that the dentist would be just very available and ready to do that. Anyway, thank you so much.